Hello dear friend, on the previous video we talked about atrial fibrillation, which is the fast rhythm from top chamber of the heart. We mentioned that the bottom chamber number determines how we feel, if we feel palpitation, if we feel short of breath or chest pain or fatigue because the heart is not as efficient as in normal rhythm. Now let's talk about possible consequences of atrial fibrillation. We briefly talked about risk of a stroke, because when the top chamber, they are not squeezing regularly and they are just shivering, there is chance of blood clot happening and going to the brain results to a stroke, which is very important. We calculate how much is risk of a stroke for every patient based on age, sex, if they have high blood pressure or not, if they have diabetes or not, if they had prior stroke, if they have heart failure. And based on that scoring system, we decide, do they need blood thinner to decrease the chance of a stroke or not? And if they need blood thinner, then we have the discussion about different type of blood thinner. In the past, many years ago, the Coumadin or warfarin was the only anticoagulation or blood thinner we were using. But we are fortunate to have a couple of newer agents past few years that they are less cumbersome compared to warfarin, because warfarin you need to do blood tests every week initially and then at least once a month to make sure the level stays in a kind of acceptable range for us. So frequent blood draw and watching what you eat, because any food with vitamin K can change the level of Coumadin in your body. So it has interaction with some food. So you have to watch what you eat and be persistent in what you eat. Also, it may have some interaction with some other medications that you take. The newer agent, they are less cumbersome because you don't need to watch what you eat. They don't need regular blood tests to monitor their level. But of course, they are more expensive than warfarin, and depends to your insurance, the copay could be different. All these, either the newer agent like apixaban or rivaroxaban or edoxaban or dabigatran, all of them, same as warfarin, they are blood thinner. And of course, the major consequence of all blood thinner is bleeding. So we decrease the risk of a stroke. There is chance of bleeding. If we fall, if we break the hip, or if we hit the head, we are at higher risk of bleeding. Therefore, your physician, your cardiologist, they look at the risk of stroke, they look at the risk of bleeding, and they determine that, are you a kind of patient that needs blood thinner? Is it safe enough? Is it worthwhile using it or not? And they give you further recommendation of the dosage and what to observe while you're taking the blood. So that's about the stroke part and prevention of a stroke when we get atrial fibrillation. The next part is other possibility that can happen when we go to atrial fibrillation. Of course, if your heart rate is fast when you're in atrial fibrillation, the heart is working much faster and much harder than it should be. And I always give a simple example to my patient. If you buy a new car and you're supposed to drive 60-70 miles per hour and you go to 150 miles per hour, you may be fine for a period of time. But when you have this car for 20-30 years, and if you want to go 150 miles per hour, probably the engine and other parts of this car cannot tolerate that fast speed that time. Same for the heart. If the heart is going 150, 160 and you're a 75 or 80-year-old person, you're not gonna do fine. If you have some blockages in the heart artery that at baseline doesn't create any problem for you, when your heart is going 160 times a minute, you may get a heart attack. Sometimes you may pass out and get syncope and get injury because of your syncope. Or you may go to heart failure. Or if you have some valve problem in the heart, with your heart going that fast, you may retain fluid and going to congestive heart failure. So those are other consequences of the atrial fibrillation can happen. Overall, it's a kind of annoying disease. It doesn't kill you right away, but it can have consequences which can affect your health and your longevity. in general, people they get atrial fibrillation, they are more prone to dementia and they have shorter longevity of life in general. So it's an important disease and a common disease, and we recommend to do what we can do for that. I gave you lots of information on this video. Let me continue for treatment option of atrial fibrillation on next video. Please take care of yourself, have fun, enjoy life, and take care of your loved one. Thank you.